Good afternoon, and welcome to today's webinar, Highly Fluorinated Chemicals in Drinking Water, an update on regulations and new research. My name is Michelle Dixon, and I am the Program and Development Director for the Mass Breast Cancer Coalition, and I want to thank you for joining us. I am pleased to introduce our two speakers for today, Dr. Laurel Schaider and Ms. Alyson McCann. Dr. Schaider is a research scientist at Silent Spring Institute, where she leads the Institute's Cape Cod water quality research on PFAS and other contaminants of emerging concern. Her areas of expertise include environmental chemistry, environmental engineering, and exposure assessment. She is a leader in characterizing sources and exposures related to highly fluorinated chemicals, pharmaceuticals, and other unregulated emerging contaminants. Ms. McCann is the Cooperative Extension Water Quality Coordinator in the College of Environment and Life Sciences at the University of Rhode Island. She has over 25 years of experience developing and delivering local, regional, and national programs focused on water resource protection for a variety of audiences, the impact of which has been to affect behavior change to achieve public and environmental health protection. She has a history of effectively coordinating community and governmental engagement activities, working with local, state, regional, and federal partners to achieve water quality protection. Laurel and Alyson, I welcome you both. Thank you.
Thank you, Michelle.
Thanks, Michelle. Thanks everyone for tuning in today, and thanks to Mass Breast Cancer Coalition for organizing today's webinar. This is Laurel Schaider from Silent Spring Institute, and I'm going to kick things off here. Today's topic is a class of chemicals called highly fluorinated chemicals, or PFASs. You may have heard me talk about these before, and if after today's webinar you're interested in learning more information, these previous webinars are available on the Be Informed section of the MBCC website. Today, my goal is to acquaint you or reacquaint you with these chemicals, give you a brief update on actions that are happening right now at the federal and state level, both related to water and other products. And then you'll hear from Alyson McCann from University of Rhode Island. Alyson and I are part of a new research initiative called STEEP. This is being led by the University of Rhode Island and also includes researchers from Harvard T.H. Chan School of Public Health and Silent Spring Institute. Some of STEEP's research and community engagement activities will occur on Cape Cod, and we're pleased to be partnering with MBCC and the Sierra Club's Cape Cod group. So Alyson will provide an overview of STEEP and let you know about some upcoming events and activities. So I'm going to start with an update on highly fluorinated chemicals, or PFASs, and some recent actions related to this class of chemicals. So back in 2009, when Silent Spring started testing for PFASs in drinking water, these were not chemicals that were making headline news. But now in 2018, things have changed a lot, and these chemicals are in the headlines pretty much every day. Last week, you may have seen reference to a health study or report by the ATSDR, that's part of the Centers for Disease Control and Prevention. They had a new report that suggested that levels of PFAS in drinking water should be 6 times lower than the EPA's current guideline value. And that report has not been publicly released because of the EPA wanting to not have that released. And so that's been a topic of conversation, particularly at today's PFAS Leadership Summit, which is going on right now in Washington, D.C. And there has been some concern and frustration by community groups because for the most part they were not invited to take part in today's Leadership Summit. That's going on right now. Only the first hour was broadcast this morning for live streaming. And then closer to home, this is an issue that's also affecting communities here in Massachusetts. For instance, in the town of Westfield, the public water supply has shut off a couple of its wells due to levels of PFAS chemicals above health guidelines, and the town is deciding what are the next steps to do for protecting its water quality. So I'm going to start out with an overview of what are PFASs, how are we exposed to them, what are the concerns, describe how they can get into drinking water, talk about how the EPA and states are responding to concerns about both water quality and beyond water. So the name of this class of chemicals is quite a mouthful. It's per and polyfluoroalkyl substances, or PFASs. They used to be called PFCs, but this term is now preferred because it's a broader term that encompasses more members of this chemical family. There's several characteristics that make this family of chemicals unique. One is their extreme persistence. So this is a class of man-made chemicals. Each one contains many carbon-fluorine bonds that are basically indestructible under normal conditions. And these chemicals have been described as persisting on geological timescales. They're also a very complex group of chemicals. A new report last week from the OECD said that there are over 4,700 polymers and chemicals in this chemical family that are currently in use. And finally, they have a great deal of versatility. They're widely used in consumer products because they have stain-resistant, water-resistant, grease-proof, and non-stick properties. I don't want to spend a lot of time today going into the chemistry of the individual compounds, but I do want you to be aware of two chemicals in particular, PFOS and PFOA. These both have an 8-carbon chain backbone, shown in blue. And as you can see, they have many Fs, or fluorines, so many carbon-fluorine bonds, and then slightly different chemistry in the green part there at the head. And so these are the two most commonly found and well-studied PFASs. They're not currently produced in the US, although they are still produced in other parts of the world. And in their place are other replacement compounds. Some of them look a whole lot like PFOS and PFOA, just with a shorter carbon chain, and then others have different variations on this same chemistry. And if you know what a soap molecule looks like, you might know that this structure is very similar to what soap looks like, and that is consistent with PFAS being used in certain products as a surfactant. So PFASs are widely used in household products. If you think of Scotchgard, Stainmaster, Gore-Tex, Teflon, even Oral-B Glide dental floss, all of these products contain PFASs. And it's very challenging, even for those of us who really try to avoid harmful chemicals and persistent chemicals in our daily lives, to avoid these chemicals because they are so widely used. Not surprisingly, because of their persistence and their ubiquity in our daily lives, nearly all Americans contain traces of PFASs in our bodies. Some communities face even higher exposure because of drinking water contamination. One of the main sources of drinking water contamination are a class of foams called AFFF, or Class B foams, and these are used to fight fuel fires, say for training for an airplane crash or a car crash. And so these are used often at Air Force bases and airports and other fire training areas, particularly related to aviation fires. There are also communities near production facilities, so near 3M or DuPont plants, say in Minnesota, West Virginia, and North Carolina, where these chemicals have shown up in drinking water supplies. There are other industries that use PFAS chemicals. For instance, Saint-Gobain Performance Plastics, that has been the source of contamination in Hoosick Falls, New York, Bennington, Vermont, and Merrimack in New Hampshire. And then there are sites where there's either landfills or land-applied sludge that can contain these PFAS chemicals, and wastewater discharges as well can be sources of PFASs into the environment. Just yesterday, I saw a report that talked about paper mills as being potentially significant sources of PFAS contamination into the environment. This graph is from a paper published last year by some of our STEEP collaborators at Harvard University. I was also a co-author on this paper, and this was an analysis of PFAS levels in public water supplies across the country. And the main finding was that that public water supplies close to one of these major sources, close to a military fire training area or an airport certified to use these foams, or near a major production facility, were much more likely to have detectable levels of PFASs. The information about PFAS health effects is a rapidly evolving field. A lot of what we know about PFAS health effects comes from studies of PFOS and PFOA in particular. These are based both on laboratory studies in animals that have found cancer, increased liver weight, and changes in cholesterol and immunotoxicity. Of particular concern for us at Silent Spring, since we do have an emphasis on breast cancer, PFOA has been found to cause mammary gland tumors and to alter mammary gland development, which we think may increase breast cancer risk later in life. We have a lot less information about direct studies of PFAS exposure in human populations. A lot of what we know about PFOA toxicity comes from what was called the C8 study. This was a major health study in West Virginia, close to a DuPont facility. Over 70,000 people took part in the study, and the results showed probable links between PFOA exposure and six health endpoints, including testicular and kidney cancer, high cholesterol, and thyroid disease. In addition, there's been work by our STEEP Center's collaborator, Philippe Grandjean of Harvard. His work in the Faroe Islands has found immunotoxicity in children. So his results suggest that children who have the highest levels of PFAS in their bodies may have a less robust response to vaccinations. So in other words, he's found that children with higher PFAS in their blood may produce less antibodies after a diphtheria or tetanus vaccination, which raises concerns about the efficacy of vaccines and potentially other immune system effects. So focusing now a little more specifically on drinking water, there are about 90 contaminants that are regulated in drinking water under the Safe Drinking Water Act. But right now there are no federal drinking water standards for any PFAS compounds. The EPA and some states have developed non-enforceable health advisories for PFAS, PFOA, and a few other PFASs. I'm going to walk you through a brief timeline here to help you see the evolution of federal and state advisories. In 2009, the EPA issued provisional health advisories for PFOA and for PFAS. These were intended to be protective for short-term exposures, and the levels were 400 parts per trillion for PFOA and 200 for PFAS. You'll see here that Minnesota and New Jersey also had issued their own guidelines a couple of years before the EPA guideline, and notably the New Jersey guideline was 10 times lower than the EPA guideline at that time. And then from 2013 to 2015, a lot of what we have learned about the prevalence of PFASs in drinking water came from a program called USAMR3. This is part of the Safe Drinking Water Act, and it's a mechanism for the EPA to learn more about the levels of PFASs and other unregulated contaminants in public water supplies. It helps them prioritize which ones are the highest priorities for future drinking water regulation. So from 2013 to 2015, large public water supplies across the U.S. were required to test for 6 PFAS compounds, including PFAS and PFOA. So what we learned from this was that the drinking water of at least 16 million Americans contained at least one of the PFAS chemicals that were tested for as part of this evaluation. What I'm showing here is an interactive map that was developed by the Environmental Working Group and the Social Science and Environmental Health Research Institute at Northeastern University. This is showing the results of the USAMR testing in blue, and in red, this is a database put together by Northeastern University of communities that have been impacted by PFAS contamination. A major limitation of the USAMR testing was that the test results were, or the testing methods were not very sensitive to PFAS chemicals, and subsequent results have suggested that these chemicals may be even more prevalent than this testing would suggest. In addition, there was no testing of private wells, and most small public water supplies were not included. Okay, and then in 2016, the EPA issued a lifetime health advisory for PFOA and PFAS. So this was designed to be protective of a lifetime of exposure, and the level was, excuse me, 70 parts per trillion for PFOA and PFAS, either individually or combined. So that's 10 times lower than the combined level from their 2009 guideline. Again, this is not a standard, this is a guideline or an advisory, so it's not enforceable. Since then, several states have taken steps to issue their own guidelines that are lower than the EPA guidelines, both a mix of both voluntary and standards by some states, including New Jersey. So you might wonder, why do guidelines differ? So it's helpful to think about the process by which drinking water advisories or standards are developed. So the starting point is an evaluation of the available information about health effects. And as you might expect, over time, as we learn more and more about health effects, we would expect to see that we learn that there can be effects at lower levels of exposure that we didn't know about in the past. So that explains why over time, we tend to see this evolution of lower and lower guidelines that are more strict in terms of protecting health. And then in terms of deciding, interpreting all of these health studies and developing what's considered an acceptable level of exposure, there can be different interpretations of the available science. Which studies seem most credible? What's the weight of evidence for different types of health effects? And so different scientists can come up with different interpretations of what this type of an acceptable exposure is. In the case of chemicals or endpoints not related to cancer, we get what's called a reference dose. So this is meant to reflect a daily intake of a chemical normalized per unit of body weight that is not expected to be associated with a harmful health effect. And the development of these reference doses includes safety factors that are meant to be protective for everyone. For cancer endpoints, these acceptable exposures are usually linked to something like a 1 in a million cancer risk. So that gives us what is considered an acceptable exposure. And then in terms of turning that into a drinking water standard or advisory, there can be different assumptions about how much water people drink and how much of this acceptable exposure can come from other sources, say from food or from consumer products. And then a final consideration that goes into the development of these advisories are determining who are the sensitive populations. So for instance, the Minnesota guideline was a revision of the EPA's guideline that they thought would better take into account or better protect breastfeeding infants. So where are we headed? Well, we're headed in a few different directions, but there's reason to think, at least at the state level and maybe at the federal level, that future guidelines related to PFAS in drinking water may be headed in a downward direction. I mentioned the ATSDR toxicological profile, which has not yet been released to the public. Internal EPA emails that were released online last week mentioned that the ATSDR report was going to recommend that the drinking water guidelines might need to be as low as 12 parts per trillion. Now, we don't know which specific compound that was referring to, but that is considerably lower than the 70 parts per trillion that the EPA is currently using for PFAS and PFOA. Closer to home in Massachusetts, this is a fact sheet for Westfield residents that said that the Mass DEP is considering adopting a recommendation to address 5 PFAS chemicals. So PFAS and PFOA, which you've already heard about, PFHPA and PFNA. So these are very similar to PFOA, just one carbon longer or shorter. And PFHXS, which is similar to PFAS. It's a little bit shorter and even more persistent in people's bodies. And so this recommendation, or proposed recommendation, would be that the sum of these 5 chemicals should be below 70 parts per trillion. So it's similar to the EPA guideline, but more restrictive because it includes all 5. And then in the scientific literature, there's evidence for effects at lower levels of exposure. I mentioned our collaborator, Philippe Grandjean's work in the Faroe Islands, suggesting that the PFAS exposure can inhibit children's bodies in producing antibodies after vaccination. And his work suggests that, that the levels in drinking water may need to be more like 1 part per trillion to really be protective of these effects on kids' immune systems. The New Jersey Water Quality Institute, when they developed their PFOA guideline last year, said that they're looked at the animal evidence of impaired mammary gland development in animals and suggested that these effects may be happening at blood levels, blood PFOA levels that are even below the U.S. Median blood levels. They opted not to use this information directly in developing the guideline, but it did inform the development of their PFOA drinking water standard because they applied an extra safety factor to try to account for these potential effects on mammary gland development at lower levels. In terms of federal action and whether there might be drinking water standards for PFOS or PFOA or other fluorinated chemicals, 25 senators have signed a bill requiring the EPA to develop drinking water standards for PFOS and PFOA. And there's some things to keep in mind in terms of whether this type of a standard or another approach is a good idea. So it is important to keep in mind that public water supplies must test for regulated contaminants that have an MCL, and they have to take steps to stay below those MCLs. In addition, having an MCL would have implications for Superfund cleanup. For instance, looking at the CERCLA, the law that established the Superfund program, says that MCLs can be used as the basis for remedial action to clean up contaminated sites. It's also important to keep in mind that PFOS and PFOA are just two of the thousands of PFASs in use. And some scientists and many advocacy groups are seeking class-based approaches that treat this whole class of chemicals together rather than attempting to develop regulations one by one. So in addition to directly thinking about drinking water guidelines, there are other efforts underway to limit PFAS exposures and PFAS contamination in the environment. Because firefighting foam, specifically those AFFF foams that I mentioned, are one of the major sources of drinking water contamination, they've received a lot of attention. And earlier this year, the state of Washington passed a bill that bans the sale of firefighting foams with PFASs. However, there's a kind of a big caveat to this bill, and that's that there's a military specification called the MIL-SPEC that requires DoD sites to use fluorinated chemicals in foams. And so there are options, in other countries use foams that do not have fluorinated chemicals. But right now, the military specification says that these foams have to have PFASs. So there are some efforts to consider whether a performance-based MIL-SPEC may be one way to reduce the use of PFAS chemicals in firefighting foams. And if this is a topic of interest to you, I would point you to this article by Sharon Lerner that talks about the use of fluorine-free foams in other countries and efforts to change the MIL-SPEC. PFASs are also used in food packaging, and you may remember that that Silent Spring Institute was part of a study last year that documented the prevalence of fluorinated chemicals in fast food packaging. Earlier this year, Washington State passed a bill to ban PFAS chemicals in food packaging, and other states have similar bills pending. So with that, I will turn the microphone over to Alyson.
Oh, thank you, Laurel. Thanks for that great summary of regulations and kind of setting the stage of where we're at. I'm Alyson McCann with the University of Rhode Island, Department of Natural Resources Science, and it's a pleasure to be here. I am going to give an overview of our STEEP project, the sources, transport, exposure, and effects of PFASs. Talk a little bit about the research that will be happening as part of this project, some of the cores that exist in our project, and then a little bit about community engagement and some upcoming activities that we have about that. Can you advance, Laurel? Thanks. So our partners, as Laurel mentioned earlier, are the University of Rhode Island, the Harvard T.H. Chan School of Public Health, Department of Environmental Health, and the Silent Spring Institute. And this is a project that is funded by the National Institute of Environmental Health Sciences Superfund Research Program. We were funded in 2017, and it's a 5-year project. So we're just have finished our first year, entering our second year of the project. The mission of our STEEP project is to address the human health threats of PFASs through our research efforts and the efforts of our training corps, our students that are working within the research projects. So an interdisciplinary science approach to help impact or to impact some of the things that Laurel was speaking about in her presentation, to help redefine perhaps the dose exposure benchmarks. So the benchmarks that go into defining human health exposure that gets translated into drinking water standards, say for example, will be part of the research. Will also be developing novel detection techniques. I'll talk about that in just a minute. And also to work with communities, specifically working on Cape Cod and Barnstable County, on long-term solutions for contaminated sites and reducing exposures of PFASs in those communities. So a little bit about the kind of the structure and the research projects and the cores for our STEEP project. We have 4 research projects. Laurel mentioned some of them in her presentation. One is based on childhood risk, looking at immune and metabolic effects. This is the project that is being led by Philippe Grandjean from Harvard University, and is taking place on the Faroe Islands, where there's been a number of years working with children and early life exposures to PFAS, and the potential for that to lead to immune dysfunction and metabolic abnormalities in children. So we're relying on an already established birth cohort in the Faroe Islands to determine possible links between PFAS exposures, immune dysfunction, and metabolic abnormalities. The overall, that this research will be able to bring to some of the things that Laurel discussed earlier is to calculate benchmark doses for possible use in risk characterization in U.S. populations that are exposed to PFASs. And so working with some of the results that this study has already shown as a way to perhaps to potentially affect, for example, the standards that are set for PFASs in drinking water. In conjunction with that, there's another one of our research studies is focused on metabolic effects. This is a laboratory study of abnormalities in rodents, looking at metabolic abnormalities in rodents exposed to PFASs. That's being led by 2 researchers here at the University of Rhode Island, Angela Slitt and Jeffrey Botham. They will be addressing whether the environmental exposures to PFASs contributes to increased risk for fatty liver disease and metabolic disorders in rodents, looking at the different behaviors of PFAS combinations that may contribute to bioaccumulation in rodents, and looking at testing the hypotheses that PFAS exposure increases diet-induced fatty liver disease and inflammation, and that the biological changes in the liver can be correlated with the body's response to PFASs. Another study research project in STEEP is environmental fingerprinting. And this is looking at both groundwater transport and fish accumulation to develop chemical fingerprints of different PFASs or PFAS mixtures. And so the hypothesis here is that environmental exposure sources, either through drinking water or fish consumption of PFASs, have unique chemical signatures, or fingerprints, if you will, which can be used to trace PFASs and their movement through the environment. So the various sources of PFASs in the environment, some of which Laurel mentioned just earlier, like the use of aqueous firefighting foams, or wastewater treatment facilities, or areas that are serviced by septic systems, on-site septic systems, that the PFAS, if there is PFAS contribution from those sites, that there's actually a specific signature or fingerprint that could be detected, so that then we can look at the movement of these chemicals through the environment, as well as also help to inform what kind of testing should be done, specifically what PFAS substances should be tested for if the area of concern is near a wastewater treatment plant or near an airport. So Elsie Sunderland from Harvard University will be heading up that research and using statistical methods to develop these fingerprinting profiles. We will be working with, Laurel and I will be working with this research project on Cape Cod, doing some private well water testing. The testing will be done in the Elsie Sunderland's lab at Harvard University as a way to gather information to help distinguish these environmental fingerprints. I'll talk a little bit more about that in just a minute when I talk about our private well water testing. And then finally, our fourth research project is about detection tools. And that's going to be spearheaded by Rainer Lohmann here at the University of Rhode Island, and Laurel Schaider with Silent Spring Institute will also be working with Rainer on this particular research project, developing, validating, and deploying passive samplers. And our field site will be on Cape Cod for this particular one. And so they will be developing these passive samplers, which then can be deployed in the environment, and testing for both water and soil water, and at contaminated sites to determine whether or not these passive samplers are a viable way of detecting PFASs both in water and in pore water. We'll be working in areas on Cape Cod, in ponds near the Joint Base Cape Cod, engaging residents and stakeholders to address concerns about long-range PFAS transport and the extent of impacted ponds, creeks, and estuaries on the Cape. In addition to our research projects, we have some cores that are part of STEEP. We have the Community Engagement Core, we have a Research Translation Core, a Training Core, and an Administrative Core. The community, I'll talk about each of these. The Community Engagement Core is focused on Cape Cod. That will be the work that Laurel and I will be co-leading. And I'll talk more about that in depth in just a moment. The Research Translation Core is composed of colleagues of ours here at URI, Judith Swift, Nicole Rohr, and Amber Neville. And they're charged with developing a variety of materials for a variety of audiences. So they'll be working with the researchers within STEEP to translate the research and disseminate that research to a variety of audiences. Our communities on the Cape, they've developed our STEEP webpage, and we'll continue to translate translate and disseminate activities and research from the STEEP project. Our training core is a group of graduate students and postdoctoral students that are working specifically embedded with our research projects. So it's developing the new generation of scientists. So the training core is charged with enhancing the resources and the opportunities for our graduate students. That's headed up by our colleague Bongsop Chow here at URI. We'll be on the Cape in just a few weeks, and we'll be coming with our training. Our trainees, our graduate students and postdocs will be joining us on the Cape. I'll talk about that in just a moment. The next slide has a link to our website. I wanted to give you a link to the actual, to the area where the STEEP research is being conducted, described in more detail. So if you're interested in that, there's the website. And then if you just take off the end of that URL, STEEP/research, you'll get to the overall STEEP webpage that will allow you to see upcoming events, more information about both the research as well as the cores, and all things STEEP related. I want to talk for just a moment about the Community Engagement Core, which will be focused in, as I mentioned earlier, in Barnstable County on Cape Cod. Laurel and I are co-leading that core, and our goal is to work with community partners to address community concerns. And our community partners on the Cape are the Massachusetts Breast Cancer Coalition and the Sierra Club Cape Cod Advisory Group, as well as we've formed a STEEP Cape Cod Advisory Committee that's made up of representatives from agencies and organizations on the Cape to work with us and help refine community engagement activities and community engagement concerns. So a little bit about the activities that we are focused on Cape Cod. I mentioned earlier that the Community Engagement Core will be doing PFAS testing and a report back program for Cape private well owners, focused on private wells in areas that are near likely sources. And this is in support of Research Project 3 that I mentioned earlier, chemical fingerprinting. Right now we're in the process of recruiting volunteers. The website for that is listed here at the bottom of the slide, that discusses a bit about the well testing, and then gives a link to provides a link to the consent form and a place for volunteers to be for you to sign up for volunteering. We will be working entirely within Barnstable County on this private well testing. So the focus is on Cape Cod, and we will be working to do 50 wells a year. So our intent is to get to 50 wells this summer, and then 50 wells in the fall. So, and then we'll continue to do up to 250 wells total over the 5 years of the project. Volunteers, folks that actually will be participating in the testing will get their results reported back to them. And again, the results will also be used to create these chemical fingerprints based on the location of the well in proximity to nearby likely sources. We'll be working with Silent Springs Report Back program that they've used in other areas on Cape Cod, and we'll be working to modify that and refine it for reporting back to our volunteers their results and next steps, how to reduce their exposure to PFASs. A few other activities that we're going to be doing on within the CEC is we're hosting an annual STEEP Science Day on Cape Cod, which will be an opportunity for STEEP researchers and trainees to share research findings and community members to engage with researchers, asking questions, helping to inform research and community concerns and engagement activities. The CEC will also be participating in community events on the Cape and be responsive to community needs by providing scientific expertise in response to local questions and concerns, and then to promote and implement prevention and intervention strategies. As I discussed with the private well testing as one effort to promote and implement both prevention and intervention strategies through private well testing to reduce potential exposure to PFASs. So in just a couple of weeks, we will be out on the Cape for our first annual STEEP Science Day on June 7th, to be held at the Barnstable Town Hall from 10 a.m. to 4 p.m. There's a link to our Science Day with the detailed agenda and time frame on it. So we invite you to join us, you know, for part of the day, for all of the day, for the portion of the day that is of most interest to you. The STEEP team will be on the Cape that day. We will be having project updates, so brief reviews from the research projects and the cores. We're going to have a film screening in the morning with a film entitled The Islands and the Whales. It's a documentary that was produced in the Faroe Islands, and as part of the film screening, we'll be having a hosted discussion with our colleague Philippe Branjam, who is doing the Research Project 1, the childhood risk study on the Faroe Islands. We'll have some research discussions with our graduate student scientists. They're really excited to participate and to come interact with the community. They'll be bringing posters of the work that they're doing, explaining their work, taking questions, and again, interacting with the community. We're really grateful that the Hyannis Water System has agreed to provide a tour of that system, a tour of the treatment facility where there's granular activated carbon being used to remove the PFASs from that water supply. So there'll be a tour in the afternoon of that system with questions and answers. And there'll also be a facilitated discussion with our Research Translation Corps for folks who want to participate, discussing STEEP information and what kind of educational materials need to be developed, or how to share educational materials and resources from STEEP with the Cape Cod community. So I hope you can join us for that event. The public is welcome, and you can come, like I said, at any time during the day, all day or portions of the day. So with that, I'm going to end my overview of STEEP and turn it back over to Michelle.
Wonderful, thank you. Well, I'd like to invite our audience to submit questions. We already have a couple that have come in. One of the first ones is a question around bottled water. We're talking about water sources, and the question comes in to ask, well, how is the filtration system in bottled water? Is this a safer alternative? Where does that come into play?
Okay, well, I'm happy to answer that question. This is Laurel. Bottled water falls under the jurisdiction of FDA and not EPA. And so in theory, it's supposed to meet the same standards that that public water supplies are supposed to meet, but there's less enforcement and testing. And PFASs are not routinely tested for in public water supplies, nor are they tested for in bottled water. And there's less testing for regulated contaminants in bottled water as well. So, so while your bottled water might have a picture of a pristine environment, so oftentimes it's tap water that may or may not be treated before it's bottled.
Okay.
You want to add anything to that?
Well, I guess I would say that if you're on a private well, that and you're concerned based on where you live, I would start by perhaps contacting your local Department of Health to see if there's been any testing done in your area on either public supplies or private supplies that may indicate that as a private well owner you would need to do some testing of your private well to see in fact if you are impacted, because as Laurel said, bottled water is also not regularly tested for PFASs. So there's some uncertainty there about whether or not they're present in bottled water or not. So if you're on a private, if you're on a public water system, you can certainly call your public water supply to determine whether or not any testing has been done. And if you're on a private well, again, you might consider calling either your local health department or your state health department to determine whether or not there's been any testing and if there's a need to do that.
Okay, thank you. And a follow-up question that's come in about the testing. A couple of people actually have asked if they have their wells tested and discover that there are these chemicals in the water, what does that do to property values?
So I'm assuming these people are asking if they're on a private well.
Right. If it's on their well and they discover that in fact there are chemicals in their water, how does it affect their property values? And then what are the requirements around them communicating that information should they, for example, choose to sell their home at some point?
So typically, at the time of sale of property, the seller discloses anything that they know about, or is required to disclose anything that they know about their property. So presumably, if they did some testing and there was something in the water that was a health concern, they would be disclosing those testing results. And what it does to the property value, there can be treatment put on in the house to whether it's granular activated carbon or reverse osmosis filters to reduce the level of, we'll talk about PFASs in the drinking water. What it does to the property level is there may be some negotiation in the closing price of the property. There may be some, negotiation around reducing the price, either to put in treatment, or, some people may choose to, not purchase the property if that was a concern to them. So, so there's a couple of ways that could play out.
Okay, thank you. And can you both talk a little bit about research going on in other parts of the state? And related to that is a question regarding, is there a chance to expand the STEEP research to include other already affected communities?
Yeah, thanks for that question. Within the scope of STEEP, in terms of where we're doing water testing or the blood testing and health studies that are going on in the Faroe Islands, at least for this round of STEEP, that's we're kind of limited by what we've set out in our initial proposal. But through the work that we're doing on Cape Cod and with our research translation core, we will be looking for ways to share what we know beyond just the Cape with other affected communities in Massachusetts as well. In the future, for future rounds of STEEP, we could be open to considering working with other communities as well.
And I have another question that's come in regarding what is taking place at the state level in terms of regulation.
So at the state level, my understanding is that DEP is considering a drinking water advisory like the one that I mentioned that would include the 5 PFASs. And I know that, for instance, DEP has been working with the Hyannis water system to help them figure out the type of treatment to install and the monitoring to make sure that their water is below the EPA advisory and stays below that. And they've been involved in Westfield as well, which is another community where the public water supply has been affected by firefighting foam.
And a general question that's come in from a couple of our members of our audience is, how do I reduce my PFAS exposure? What steps can people take?
Mm-hmm.
Yeah. Well, I know that.
I'll mention. Oh, go ahead.
I was just going to say, if it's in your drinking water, I mentioned earlier, there's some point of use if you're on a private well. There's some point of use treatment systems that have been certified for use by the National Sanitation Foundation, both granular activated carbon and reverse osmosis filters to reduce, to put on a particular tap in the home. And then, Laurel, the slide that you had earlier, I don't know if you want to go back to that or not, but about the sources of STEEP, it's a nice one because there's the sources, and so as best, oh, there it is, yeah, as best that is possible to minimizing these sources in your life, in your daily activities.
Yeah, just building on what Alyson said, these are some of the common consumer products that have fluorinated chemicals. Some of these are easier to avoid than others. For instance, you can make microwave popcorn, not make microwave popcorn, you can make popcorn on your stove. And there are some options to switch things out, but in other cases it's hard to know because these chemicals aren't labeled on product labels. Labeling can be confusing. For instance, there are products that are labeled as PFOA free. So you might say, that's great, it doesn't have these PF chemicals, but it just means that it doesn't have PFOA. It might have other chemicals in the same family. As I mentioned, PFOS and PFOA production has been phased out in the US, and they're being replaced with similar chemicals. So there are some things that we can do at the individual level, but I think steps like what Washington State has been doing to ban the use of these chemicals, especially in something like food packaging where it's easy to find a substitute, you know, is a way to help everyone reduce their exposure, because again, it can be hard to know what's in some of your products.
Sure. Great, thank you. Do we have any more questions? Okay, I've got one more for you. I've heard that fluoride in water is a health concern. Is fluoride related to these fluorinated chemicals?
Yeah, I've gotten that question before. So fluoride is like a fluorine by itself in water, and it's added to many public water supplies to help prevent cavities. And some scientists are concerned that that the levels that are added may be harmful to health. The chemicals that we're talking about are these large compounds. I'll show a picture here that have many of these same fluorine atoms attached to it. So they are very different chemically and associated with different health effects.
Great, thank you. Okay, well, if we do not have any more questions, I would like to say on behalf of Cheryl Osimo, our Executive Director of Massachusetts Breast Cancer Coalition, and our Board of Directors, I want to thank you, Laurel and Alyson, for all of this information today. And I encourage people to please visit the STEEP website and learn more about the upcoming event on June 7th. And I want to thank all of our audience members for taking time out of their day to join us, and to let everyone know that a recording of this webinar will be available on the NBCC website later this afternoon. So Laurel and Alyson, thank you both for your time and your expertise.
Thank you very much, Michelle, for hosting us and organizing it. And thank you to NBCC also.
Yep, thank you. Thanks, everyone.
Thank you. Have a good day.